sorry, we can't be in every place. People do things on the weekends when they think we don't, we're not there. I stop, all the time. Staff stop all the time. Environmental people stop all the time or call us and say, we see what's, So it is a problem. We had it 2 years ago, before COVID, we were at the point of a hearing with someone who adamantly continues, so much so, take this time, that Taco Tuesday, if they are operating at such frequency that they have theme days, but if the public is supporting them, they only let us know when they have a complaint, it's hard to be in all places at all times. So we do what we can. If you see somebody, call us.
The follow-up question is, there are a lot of little leagues, soccer groups that are, sporadic. They tag onto a gas station and, they do quarter pit chicken or they do things. So same answer probably, you don't know when that's going to be?
No, the Porta Pit, Nelson's and other companies that have the same concept, that for-profit entity is inspected and permitted. The not-for-profit is not and does not have to be unless they operate 15 calendar days in a year. So the soccer or whatever, they're not-for-profit organizations, they only do 5 or 6 or 10, and so they can do, that. Eat at your own risk and pray over your food before you eat it.
They're making a lot of money, and that's good. So, thank you.
All right, any other questions on the health officer's report? Hearing none, can I get a motion to approve?
I motion to approve the health officer's report.
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. I lost my agenda. Next item on the agenda is new business. First item, 2530, is discussion of vote to amend and supplement Title 11 business regulations, massage establishments.
So as I understand it, there's been some not quite hammered out details, and we're hoping to push this for the moment. So I move to table this until perhaps next meeting.
Second.
We have a motion and a second. Any further discussion this time? We're just not quite ready on the details of this one yet. Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2531, discussion of vote, amend and supplement appendix, schedule of fines and fees of the St. Joe County Code.
I would like to just give a brief introduction about the fee schedule in general. But I would be remiss in not thanking Amy and the unit directors for their hard work in looking at this. Amy has, and Jenny typed it up in a format that I didn't even know existed, with wonderful colors, and so shout out to Jenny and Amy and the unit directors. The reasons for looking at our fee schedule are multiple. We've been looking at it for several months, and I want to assure the board that this is not to try and price gouge any citizens. That's not the reason. We are trying to recoup costs. We've been doling out, for example, in vital records, many people will ask for an envelope, or they will ask for the clear sheets that cover the wallet-sized birth certificates, or they'll ask for a cover for the full-size certificates. Those are things that we have to purchase above and beyond that we are merely trying to cover our costs, and we haven't been charging for that. The other thing that recently happened is the auditor's office requested a copy of all of our fees, our fee schedule, and then requested that we compare our fees to 4 counties. I believe it was Elkhart, LaPorte, Allen, and I forget the 4th county, but 4 other counties to see what their fee schedules were, to see how we matched. And then so we were already doing that anyway, but the auditor's office spurred it in a quicker way because they had a deadline that they wanted our information back. The third thing is that, and looking at this, many of our departments had not increased several of their fees for up to 8 years. And so when we looked at it and tried to be reasonable and practical, we said, okay, cost of living is 3-4% up a year, just the annual cost of living increase. And so we said that what we would do is we would increase the fee by 2% per year for a maximum of 5 years. So if it had only been 3 years since we raised our fee, we only went up 6%. If it had been 10 years, we only went up 10% because 5 years was the max that we were using that 2%. So 2% per year since the last time the fee had increased. And we did balance that out with looking at the neighboring counties to make sure that it didn't look like we were running some sort of mafioso ring. We want to be reasonable. We want to offer new services. A new service, for example, would be the ground penetrating radar location. That's not something that is sort of a huge demand, but in general, that is sort of a luxury request, and so we feel that we can charge what is appropriate, what the market price would be for that. Another example would be charging for charging higher prices for genealogy searches, because those can be labor intensive. Some counties charge $75 for, in their vital records department to do a genealogy search, because it's not necessarily, I'm not saying that everybody's a hobbyist, but it's not necessarily a genealogy search is going to depend on you being able to get your ID or your death certificate or your birth certificate or insurance. It's more of a hobbyist type thing most often. And so that also, those were the kind of things we looked at too, like, is this something that people really need? We're not going to try and really raise that price. So we tried to look at our expense on copying, copy machines. Anybody who's a small business owner knows that you rent those copy machines. The ink is expensive. If you buy cartridges for your home, paper. So it does add up, black and white's cheaper than color. And so those are things that, again, we are not trying to make a buck, we're just trying to cover our costs. And I will let Amy take over.
Can I ask you one quick question? So you said there's a 2% increase per year. Is that something that's built in, that once it's voted and it's approved, that's going to happen automatically every year?
No.
Okay.
It would have to be done each fee schedule. And we were just trying to think of a reasonable way of how much do we increase these fees. And we wanted it to be an increase, but we didn't want to go over the cost of living increase.
It'd just be convenient if it was built in that it happens every year. We can't do it that way.
Yeah, we would have to have approval of the Board of Health, go to the county council. It would be the same process over again. We're able to do it at the beginning of each year, or at the end of the year, so we're ready for the first of the year. We absolutely can do that, but we have to go through the process each year. So as Dr. McLeary mentioned, the fees are very nicely color-coded. Anything that is in green is a new fee and service that we want to offer within the whole department or within a specific unit. For the whole department, having a convenience fee, we do have 2 units that we have 2 units that we do invoicing for. Our death certificates, we invoice our funeral homes if they wish, as well as our septic and well installers. So charging a fee for that invoicing service, a convenience fee. That way they don't have to come in each time to drop something off with payment. We offer the option of them to be on a monthly invoicing system. So we're going to start charging for that 3% of whatever the cost of the invoice is for that customer for that month. And then also adding on a convenience fee for mailing of items. Also any late fees for late invoice payments received, trying to get them to be on time with the invoice payments that are due to us. As we go through to environmental health, as Dr. McLeary mentioned, a new fee is the ground penetrating radar location services, as well as a travel fee for that. This unit, anything that they did request an increase on is at the 10%, since it has been 5 years since those items have been increased. So it's a 10% maximum increase of those items that are in yellow. We also have the foods unit, which they are increasing their late fees for every item on their fee schedule, going from a 75% late fee up to a 100% late fee. So they would pretty much be paying double for their permits if they are late. We are also adding in a separate administration application fee for any planned reviews for new permitted establishments in St. Joe County. Regarding the nursing unit, all of their fees are based off of what VaxCare has as their fees. For every vaccine we offer outside of TB and travel vaccines, we get those through VaxCare. VaxCare did just put out, the timing was great, as of September 1st, an updated cost of vaccines. So what we do is we take the cost of vaccine that VaxCare has, adds on a slight percentage just so we have some wiggle room so we don't have to do this every month, and then the $15 administration fee on top of that. So that's how all of the nursing fees are figured out. There is one new vaccine on the fee schedule that is being offered now through VaxCare. Meningococcal A, B, C, W, and Y. It is on the, I believe it's page 47 of the packet. It's highlighted in green. That is a new vaccine that we will be offering in our nursing unit.
Is that, so it says, I can't find it in my thing, but it was 246 or something like that, or is that for these, it says something about a series, is that?
246 per dose.
So each series of all these different, are these all included in one? So
That's
if you
per
wanted all
dose.
those, it'd be a lot. Okay.
Correct.
Okay.
Oh, no, if you're talking A, B, C, W, and Y, that's all included in that vaccine.
Okay.
I thought you meant the series.
Okay,
Yes.
that's what I
No,
wanted
we
to
get
know.
all of that in one vaccine.
Got it.
But if it needs a second dose, then you would be paying $246 again, or insurance or something of that sort. No, it's not individual. Sorry, I misunderstood that question. We also wanted to add on in the nursing unit some replacement fees for lost or misplaced yellow fever certificates, as well as for immunization records. They do receive an immunization record at the time of immunization, but if they need another copy, just our cost if they come in office to print that, or if it's electronic, there's a separate fee, and then if it's mail, there's a separate fee.
And as far as the electronic or any of these requests, can those be done online? Like, for instance, they pay a fee online and it sends it right to them. Is it automated or?
It's not automated to send it right to them. Our staff members would get a notice via email that a request had come in. They would have to search the record and then email it to whatever information was provided, but we do currently offer that in quite a few of our departments. And a few of our units, yeah.
So how do they pay for it? They pay electronically?
Right, you pay online through Civic Plus. Unfortunately, the only way to pay online, we don't take like check over the internet. So there is a fee through our credit card processing company. So whatever our fee is for the electronic version that they're receiving, there is a $1.55 charge on top of that. That goes straight to the credit card company, doesn't even filter through to us. So for an electronic shot record, it would be $2.55 for that customer to get, but it would be emailed right to them to have.
There's always the option of coming in. You pay for convenience. Anybody who comes to the environmental health department and wants a permit for something, or food department, they don't leave with that permit unless they pay right then and there. The bigger, like the funeral homes and vital records and some of the companies, the contractors, they're paying an invoice fee for convenience of being billed. And they get 30 days from the date of invoice to pay, but it's a convenience. If you want convenience, you pay for it, but if you want to come to the department, then there's
You
no.
don't issue a permit though until they pay, correct? You're not issuing it and then you send them a bill.
Usually they pay up front for
Yeah.
like septic when they drop it off and everything, if I'm not mistaken.
That's why I'm confused about the invoice, like they shouldn't be owed money and making them a service already.
Or even late fees.
Yeah, so if someone comes in with a permit, we won't even review it until it's paid for, unless they're on our invoice. And if they're on our invoice, then we'll go ahead and start the review process.
But it doesn't get issued till it's paid, like we're not, you're not even saying.
No, we issue them. If they're on invoicing, we'll go ahead and issue them.
Okay.
That's kind of the convenience of the invoicing.
Are you experiencing any trouble with collections or anybody not paying?
No, because if they get to 60 days past due, I cut them off and revoke all permits so they can't do any work. So they usually pay. I mean, usually we just give them a phone call and say, hey, you're late, we're going to cut you off at 60 days, and then they pay it. So we've never had any issues, really.
So have you charged a late fee for those in the past? So now if somebody is late, they will be assessed a late fee.
In the past, we did not charge for invoicing,
Yeah. Okay.
but we just cut them off, so it wasn't, we didn't let it continue. you
Well,
know.
it was nice of us to even do that, I would be like,
And going forward, it's gonna be a 3-strike, you're out. Like, we're not gonna let you go late every month for 12 months. It's 3 strikes, you're out, now you gotta come in and pay at the time you're dropping it off, because we're not gonna be,
well, that's making someone a paperwork nightmare to keep track of that stuff, so.
That's, the late fee was added as an incentive, because you'll notice it's a percentage.
So who monitors that?
it'll be up to each unit that does the invoicing. So for vital records, they do the death certificate invoicing. I believe that's Erica and Denise that monitor that. So for environmental health, Melanie does the invoicing, the administrative assistant. So she would be monitoring when invoices are due and
we're not spending a lot of time or resources, human resources filling that, right? Like
Keeping
sometimes
track.
that's right, yeah. Like why? I guess if we are spending a lot of human hours doing that, then why are we even doing it? We don't have to do it.
You just invoice them the one time. And if it's
Then
not
if they don't
paid,
pay, you have to go back and track who's. I mean, I only know that stuff because running your business, you're like, it's a nightmare to keep track of. So I just didn't know we spent a lot of time dealing with it and why even do it.
Yeah, that might be something we want to start tracking or getting that information, and that's why we're charging a fee for even doing it in the first place, because it takes manpower, it takes time to get all the information together to create that invoice and send out. we definitely don't want to discourage our customers from using it. We just want to make sure it's benefiting both them and us for offering the service.
Because most people that are getting permits for building and different things, they can afford to pay, they just don't feel like doing it. So,
We're gonna help them feel like to do that.
I like the idea of tracking the man hours and seeing how much wasted time on our end is happening dealing with people that just want you to bill them. It's like, that's not how it works. Amen.
And out of county fee service, I wanted to point out that because especially all of our departments, but our vital records is notorious for getting those death certificates and birth certificates to the person who's requesting them very swiftly. And a lot of people from other counties like to request them from here because if you request it from the state, it's free, but it's going to be a 30 to 60 day wait.
So for like birth certificate, death certificate, you're gonna get a paper certificate, correct?
Correct.
So any fee where the product service that you're getting is a paper, like legal document, copy of something, that's already built in. But these copies, when you're talking about getting additional copies, that's like a service where you're emailing somebody something, but they also want, instead of printing it out themselves, they want you to print it out. So you'll do that, but you charge 5 cents a copy.
Yeah.
Okay. So that, but it's not like an additional fee for people who are, like that is the actual product that they need as a physical copy, like the birth certificate.
Right.
Okay. Okay. Just wanted to be.
And with, for example, FOIA or APRA requests, we're permitted to charge up to 10 cents per page for copying.
That's
That's
the
just-
5 cents is
Yeah.
like for the FOIA request, unless you want them in color, right?
And it's
Correct, and then it's 15 cents for color,
Correct.
yeah.
But you usually just email them, right? Just email them, or do you have to give?
Yeah, usually, but sometimes people have a lot of things that you can't email.
Okay.
And then regarding the last unit in the fee schedule, the vital records, increasing their birth certificate wallet, since that is provided inside a plastic sleeve, the additional $1 for having that sleeve with the birth certificate. And adding on a new fee, it's not a new service, we currently do this, but we're adding a fee to it where if we make any court order changes, we are now tying a fee to that since it does take some of our staff members' time in order to make that change on any record. So it is now we're requesting a $20 charge per court order. And if they need a copy of that court order after it's done, a copy of the court order change, then it would be a $20 fee to get a copy of that court order change.
Is that something other counties do? I'm assuming that's something we're permitted to charge for?
There was one other county, I can't remember which one. Elkhart. When we did our study of the 4 counties, and the other one was Marshall County. Marshall, Elkhart, LaPorte, and Allen were the counties that we were asked to get their fee schedule for the whole department and submit to the auditor's office so they can compare ours to theirs and see what can be charged for.
With these proposed changes, are we fairly consistent with what the fees are in other departments? Is there anywhere where we're charging more?
Well, it's hard to compare apples to apples because we do a lot more in our county than a lot of the counties that we had to compare with. And one of the counties, they have a whole dental clinic that obviously we don't have, or an STI clinic. But when you're looking at like a food service permit, one of the counties bases theirs on how many inspections are done on a year, and that's how their permit fee is generated. So it's really hard to compare because nothing is the same between the counties, but it seemed like it was pretty fair for what we are charging that other counties do have available within their county, pretty much like septic and food inspections, as well as vital records. That seemed to be something that was seen in every county that we had to compare to. And then as Dr. mentioned, the out-of-county service fee, and that pertains just to our vital records unit where you're able to go to any Department of Health within the state of Indiana and request your certificate. So having an additional fee for that because there's more work for our staff member to contact the county that it originated in, make sure the information is correct. There's a lot more work than just going to their computer system and printing out that we know we put in the system, so.
And if you're a St. Joe County resident, you're not affected by it. Oh, do other counties do that? Charge that?
Some are starting to. It's still very new. There's lots of discussion on what counties really want to make that available to the public. So I did see it on a few fee schedules that we had to compare though.
And it is a statute that all counties must provide to somebody who requests, so it is an Indiana statute.
Yeah.
So that's a brief summary of the additions, reductions. Some fees have gone down that we are proposing for our fee schedule. It would go, if it is approved today, it would go to the county council's first reading in September, and then their committee meeting at the end of September with a public hearing in October. So the soonest we would be able to implement these changes would be middle October.
So once it's passed, you're gonna implement that immediately? Or we're not, or are we waiting till like January 1st?
At the most, I think we would do it November 1st if we wanted a clean date.
Okay.
Yeah,
Okay.
sooner rather than later, maybe not in the middle of October, maybe we would say November 1st, just to give, by the time it's approved, to give, posting and notices of the changes.
Okay, so kind of beginning of the month following when this all gets approved, wrapped up is probably later. Yeah, okay.
You answered the first question I had regarding the equity of costs across the counties that surround us, Elkhart, Marshall, and Fort. Do we get any business from Berrien County and Cass County, anybody coming over the state lines?
I do believe we get some in our immunization clinic. I don't know that it's a large amount. I don't know if that's something that's tracked but I do believe we do get some patients from Michigan to our immunization clinic.
But our immunization fees are based on the service provider, or the vaccine provider.
Correct.
What they are, and kind of, we almost have like a formula that.
Correct. Right now, there is no difference if you're a Michigan resident or an Indiana resident for a vaccine that we offer.
But even the changes are, it sounds like they're really more just reflective of.
The VaxCare charges that,
cost.
yeah, correct.
Thanks for color coding.
So that'd be Jenny.
Dr. Migliore, can you speak to looks like you added some fees for violations of chapter 114. If I read this right, did we also add that up to chapter 113 up above?
Those aren't new fees, I'm sorry. Those aren't new fees, we're just adding them to this fee schedule, so everything that we charge for is in one place. Those are currently in those ordinances. We're just adding it to our fee schedule, so absolutely everything that we're able to charge and collect for is in one place.
Okay. So it's already in
This is kind of a adjacent question, but it was something I was curious about. Like with vaccines, let's say that, do we pay for the vaccine ahead of time, or like we order vaccines, the department orders vaccines, do you pay at the time that you order the vaccine and then kind of hope that you use them up, or do you, how does, do we, pay as you go, or?
Through VaxCare, no. We do not pay for the vaccine until it's administered, and we actually just get depending on if the patient is paying at the counter or if they're going to be billed through their insurance. We pay once the vaccine's used, except for our travel vaccines that we do purchase on our own, and obviously those are purchased and we charge for them as they're used, but for the VaxCare part of it, we are not charged for the vaccine until it's actually used.
Okay, so if for some reason you have an excess of some amount of vaccine, maybe you kind of miscalculated or didn't, you didn't use as much or whatever, not flu vaccine or something, at some point you just send the extra back?
Yeah, we're able to send it back to VaxCare, yeah.
Okay, and
Yeah.
then no financial cost?
As long as everything is returned,
Okay,
the correct vaccine's returned and everything's,
okay,
in order, yeah.
okay.
Everything's scanned in when we get it,
Uh-huh.
and so they know exactly from that individual scan what we do have and what we don't have and what we've used. So it's scanned in for inventory, and then when it's used, it's scanned out, it's administered, and so it's very closely tracked.
Okay, so you would even know, like, which batch, like if somebody received a vaccine from a certain batch, you know that they received from that batch.
Exact lot numbers.
Okay.
And the vaccines that we purchase ourselves for use they have a similar fee schedule?
What our cost is, that's what we use to start the process, just like what VaxCare's cost is to us. We use that as the base, add on the 6% for wiggle room, just so we don't have to continually be changing the fees, and then adding our $15 on top of it. We take what our cost is for those individual vaccines.
The 6% covers the syringe, the alcohol swab, the Band-Aid, the supplies to administer, even the needle.
Ours are not cheaper though. We don't provide the same type of vaccine. You know what I mean? They're different.
Right. And the travel vaccines are mostly like yellow fever and people going to Africa usually.
Yeah, the vaccines we order are not available through VaxCare. That's why we're ordering those.
There's a new flu vaccine coming in the fall, and also a new COVID. So what is our relationship with the other service providers, Walgreens, CVS, those people? They can still come to the health department for those services as opposed to going to where those outlying suppliers may be.
Oh, absolutely. If they have
Probably
insurance,
less expensive.
if they have insurance that is covered with VaxCare, VaxCare will bill their insurance for the vaccine. If they're eligible for 317 or VFC, we would offer that vaccine to them. Or if they don't qualify for either of those, they would pay the amount on the fee schedule for either of those vaccines that are administered.
So we're offering more choices. Okay. Good.
And many pharmacies do not give vaccinations to people under the age of 18. They only give vaccines to adults. They do not want to vaccinate children.
All right, any other questions? Hearing none, I'll entertain a motion to approve the proposed fee schedule.
I make a motion to approve.
Second.
We have a motion and a second. Any further last discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2532, discussion and vote, job description, contracted immunization nurse, certified medical assistant.
Hello, Ashley Hellman, Director of Nursing. So whenever I have the joy of having a nursing student, I tell them the first thing that they need to know about public health is that you have to be ready for change because it happens all the time. So the job description that we had in front of you was for a medical assistant and a nurse, and we are going to go ahead and just go talk about the medical assistant role. this month, and then next month we'll bring a description with only the nurse's position. And you're probably going to hear a lot of the same stuff next month, but we just want to make sure that there's two clear descriptions for the hiring.
So this job description that says the position is
Immunization.
nurse / certified medical assistant, that's changing.
Yes.
So what we're doing, this is just for a certified medical
Yes. Yes.
assistant, okay.
Yes. And Ellen has a marked up copy.
I do. Would the easiest, would the easiest way maybe be to go through each part and then just say that's staying, and then, or we will strike this?
Sure.
Would that work?
Is that good for you guys?
Council?
Or is that
Okay.
something that if it's a lot of stuff, maybe it needs tabled and redone, and we can review it then?
We don't,
It's actually not a lot. We just took
Yes.
out
Yeah.
the immunization nurse and left the certified medical assistant.
and there's a time issue that
Yes.
you want to have one of these positions.
Yeah, we were originally going to table them both, but due to
have-
staffing issues, we need.
Okay.
So I don't know if you want, if you want to talk, not exactly. So maybe I'll tell you a little bit about it, why we're here talking about it today, and then we can go through and look at the actual description. But basically, we are proposing reallocating our PRN positions to use them as a year-round resource. So as you know, our current staffing levels are lower than they have been in the past, and everybody has stepped up across the board in the entire department to make sure that we're able to provide services that our community has come to expect. Unfortunately, there are still times where our staffing levels are not enough to guarantee services and uninterrupted patient care. So PRN nurses and registrars have traditionally been used for our COVID and flu seasonal clinics. We would like to be more intentional about using those PRN resources and use them year-round instead of concentrating them in the respiratory season. So we would, yeah,
What does PRN mean?
it as needed.
Oh, okay.
So,
Okay.
yeah,
So-
sorry.
Okay.
So they would only, we would use them to cover illnesses, vacations, and then to increase our capacity to have clinics for times, especially back to school. Right now, we are all going out on clinics, the public health nurses, myself, someone from Vital Records is going out to register patients. Like I said, everybody is really stepping up and stepping in, but we want to make sure that we don't have to say no when we have a large clinic and a large ask. And so we'd like to be able to utilize the medical assistant for those times where we know that we have a need. The COVID and flu, it was a great resource, but as we continue to do it over time, we're able to absorb those vaccines in our main clinic. And so a lot of the times the after hours and Saturday COVID and flu clinics had no people, basically. But if we are able to kind of re-envision how we use those as needed positions, then it will help us to have our response be accurate during our busy seasons. It helps conserve funds because we don't have to try to figure out how to hire more long-term positions, and then it helps us keep services available. And in the end, that's really the biggest thing, is we just want to be able to provide services.
So these would be contracted workers who only work on an as needed. There's no guarantee of hours. We would try to have a bench of 2 or 3 deep, so that a staff member calls in sick or has to have emergency surgery or, you know, has a death in the family and you've got all these clinics you need to run, you still need to run the department, then we can call them hopefully to, you know, fill in. So you're backfilling positions basically.
So we're not budgeting for their pay because it's just as needed. So, or we're okay to
We have
pay.
to be, yeah, we have to be able to approve that
Yeah.
as a year-round service.
Well, it would be in the budget though, we'd have to have it in the budget.
It's budget neutral.
Yeah.
It's just changing how we're using them and adding an MA for flexibility. Having an RN is our best option because RNs can vaccinate off-site. If we have a medical assistant vaccinating, there has to be an RN working with them because they're working under the RN's license. And so we can definitely use an MA here in the building as well as our larger clinics where we have 2 vaccinators. But we'll talk more about the nurse.
So how do we want to proceed on this? Will someone walk us through the changes you want to, what's in front of us? Is that?
Well, I think what we were thinking was, and Ashley, please tell me, on the very first paragraph, incumbent serves as, so right here, we have to cross out immunization nurse and write certified medical assistant. And
Do we need to approve these paragraph by paragraph, or can we just talk through them all?
You talk through them and then you just make a motion to approve as amended.
Okay.
all right, and skimming through, and hopefully Ashley will tell me if there's anything else that we need to amend. It sounds like, well, in the second.
Job requirements.
Right.
Oh, sorry.
Oh no, please. What were you gonna say?
I was gonna say under job requirements,
Yes.
the associate's degree in nursing, we would remove that. And then also the second paragraph, nursing candidates will, the certifications that a nursing candidate would have.
So the first 2 paragraphs for the job requirements, we would just X out, eliminate. And Ashley, correct me if I'm wrong, the certified medical assistant candidate paragraph is sufficient. You
Yes.
don't need any to write about any other educational requirements.
Correct, because the job duties are similar.
Okay. And I'm assuming that there is nothing else skimming through that we would need to change, get rid of?
I did not find anything else, but
Okay.
if anybody else does.
So under duties, I feel like you need some clarification because a lot of this stuff is geared toward what nurses would do versus an MA. Meaning, I assume you don't have, like you're talking about, reviews the patient record, assures accurate administration, talks about side effects, remedies for side effects. Basically, that's informed consent.
So we have a medical assistant right now in this role, a full-time immunizer on site. She is fantastic, and within her scope of practice, she does do all of these things. So she advises our patients on appropriate vaccines. She reads the vaccine schedule, lets them know about potential side effects, and how to treat those if they are an
Is she
issue.
the one actually signing for informed consent though? Or does the nurse have to do that?
No, the nurse does not.
We use MAs in our clinics, certified MAs to do that too.
Okay, I didn't know you could do that.
At the very end of the process, Dr. Migliori signs the charts. I sign as her proxy, but so there is another set of eyes on the charts. But yeah, they've come a long way, I would say. And if you have a good medical assistant, they can do.
Yeah, I just didn't know they could legally do that. So if they can, that's all.
So just to be clear, in section Section 4, personal work relationship. It says incumbent reports directly to Director of Nursing. That's still
Correct,
okay.
yes.
Okay. I remember there's one other change in the very last, on the last page, applicant employee acknowledgement.
Yes.
We want to change that. We want to say the job description for the position of certified medical
Yes.
assistant,
Yes.
I believe.
Thank you.
And it says grant funded position. Do we need grant funded in there at all? No? Okay. Then we'll strike that. I'm assuming everybody else is.
And I thank you for your flexibility as well today in helping us move this forward. Do you have any other questions or, yeah?
In this process, have we ever explored IUSB School of Nursing and Ivy Tech School of Nursing for these types of candidates that have not yet reached a nursing degree but are required so many hours in the community to?
So we do host nursing students. We're not hosting them this fall, just due to reorganizing our own staffing levels. But yes, we utilize them in the clinic. Typically, they require a lot more work than they are help, but we are doing it as a service to them, and we love having them. But yes,
You still have to have someone
yes,
knowledgeable and
reviewing
has met the
everything.
requirements as you
Yes.
see. But I didn't know that years ago through Connect we had a school health partnership project with all of the universities preparing students for that first level stage, and they were looking for practicums or some way of learning on the job before they graduated. So
And the schools of nursing, back when I was in nursing school, we won't say how long ago that was, you had a site for community health. So by the time your clinical rotation was done, you were fat. You could really understand that role and be of assistance to the location. Now they have it a little differently where they have students for 1 or 2 days in multiple locations so that they're experiencing more, which is great for them, but also kind of takes away the ability to, they're cycling it through more quickly.
I presume the position title should, human relations nurse
Yes.
struck as well. Any other questions or comments?
I do think we should look at and this was just a quick search. I don't think legally MAs can do informed consent for vaccines. So I do want you guys to look into that. It's gotta be a nurse or a provider. So FYI.
I will definitely look into that.
I know you guys are signing it off, but if they're actually doing the informed consent and then giving the vaccine and then you're just signing off, then technically there's no informed consent happening, so that's not good.
And all of the vaccinators do work under standing orders, which are signed by Dr. Migliore as well, so we can utilize those to make, but I will look more
Yeah, it
into
just says
that.
you can't delegate.
Informed consent.
So based on that, is there anything you recommend change on this description?
I don't know if there's a way to write that into the job description somehow. I'm not sure how you would change the verbiage, but.
And I believe that this is a similar job description to the medical assistant we have now, so if there needs to be a change made, it will need to be made across the board, so we'll have to look into that. And
Is it this third point under duties? Is that the one that goes according to under duties, it's the third paragraph. That's what I was asking about. So curious.
It doesn't use the language informed consent, it just says
Like, really just
information.
talking about like the BIS handout.
Well, what would you consider informed consent to be? Like actually reviewing all of the things listed in 3. So you're checking, you're looking at their previous immunizations.
Well,
you're-
those are part of informed consent. The actual informed consent is the part that they actually consent. So giving them information, handing them an information sheet is not in and of itself informed consent. It is necessary but not sufficient. So yes, they need to know that stuff before they can give informed consent, but it is not, again, it's necessary for informed consent, but it is not sufficient to be considered informed consent.
So you're saying that that provides information regarding immunization and possible side effects and remedies for side effects isn't part of informed consent?
No, it is, but what I'm saying is that doing that is not automatically, so it is part of informed consent. But you are not saying that they are getting informed consent, they're just providing information about the vaccine. I mean, you can get that from anywhere, literally, right?
Who gets the informed consent?
Well, it sounds like, so, well, according to this, there is no informed consent described in here. There is only stuff that is part of informed consent in the description, but it's not actually saying anything about informed consent here.
Would the nursing physicians have that language?
It does not specify informed consent either. When we are audited by state, which happens about annually, what they are looking for is that we provided the BIS, which is the vaccine information sheet that has the information about the vaccine, and just saying that we provided it, the date that it was provided and the date it was published is what state is looking for.
Maybe it just needs to say that, like, because this description to me involves some detailed thinking of what kind of vaccine are they getting, which ones do they have recently, are there interactions between their own medical history and the vaccine, like it's a little bit more complex thinking. If you want to maybe change this, eliminate this paragraph and put providing the sheet and like what basically they're doing, and that to me says they're doing a lot more than they legally or should.
They are reviewing the records though, and looking at what needs to be administered and explaining and telling the patient these are the ones that are recommended by the ACIP for your child's age group or for wherever you're traveling, by the CDC. They are providing that information.
They're following the recipe, so to speak, their standard.
I mean, I can read this in a way where it sounds like they're just kind of like checking the boxes. Now, whether we want to say under the supervision of the on-site nurse, da 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 da, that. I don't know if we need to.
Who signs off on
But
it?
Yeah.
Who signs
Who's
off
giving
on it?
informed consent? Because you really do have to do
This
that.
part,
Who signs off on the chart?
yes.
Whoever administers the vaccine. So
So they're the ones that need to be comfortable with the language
And
we're
we're
comfortable
legally
with
able
what
to do
they're
it.
Legal
Yeah.
bound to it, so I mean, Kristen has that point of, like, ultimately, legal responsibilities are critical consideration. Not comfort.
Right, it's not about if you feel good, like, I feel like I can explain this to people, it's like, well, the law says you aren't allowed to legally get informed consent, and we don't want to be putting them in a position where they're signing a chart saying that they described all these things, or even decided if a vaccine was appropriate for that person, because that isn't in their degree. And it's setting up the health department up for a lawsuit. If someone were to have an adverse event to reaction, they're gonna go back to that paperwork and say, well, who told you about all these potential side effects? And we don't have anyone doing that. And MA is allowed to do it. We're not legal.
I need to look at, I think I need to look at the language.
And the law, what the law says. Sorry, you know,
Can we ask for our council's recommendations on whether this is sufficient as is or not?
At the end of the day, it's my name going on the chart, so it's my,
Yeah. I mean, we have another bullet point in here, paragraph in here saying manages care clients using established protocols, ensuring compliance with applicable department policies and procedures, IDOH standards, HIPAA, federal
Yeah.
state laws regulating the privacy confidentiality service delivery. I would think that would hopefully cover.
I would just say, if it
in
was
terms of
me,
the job description.
I would remove that third paragraph and change it to say that they're following protocols of the health department under the supervision of the director of nursing, the medical director, and giving the patient the sheet to review. If that's what they're doing, just don't put all of that on that job description, because it's not in the public.
so in good faith, are you guys comfortable with us posting this job description? And between now and next board meeting, if we need to change the language after we get legal consultation, then we can make an amendment at that time, because to be honest, it's not likely that we would hire somebody tomorrow.
I mean, look at this. I think Dr. Hayes is correct. I mean, every time I go to a doctor, that you go in and, the assistant says, here's what's going on, here's the drug, here's the side effects, here's whatever. And the doctor comes in and says, they explain everything to you. Do you have any questions about this?
That's not what's happening now.
No.
That's not happening anymore. It's
Well,
an
that's what's in the job description. We're only approving job description. So we need to change the way they do things. That doesn't impact paragraph 3, which simply says they review patient records to make sure that immunizations being administered, explains to the patient what these immunizations are, provides information regarding immunizations, possible side effects, pharmacy side effects. So then you then have the RN come in and say, do you have any questions regarding side effects? Should
But you have to they get a shot before actually.
But that's a process question, not a job description.
Right.
I just think you should take the pressure off of the MA.
There is no pressure.
paragraph.
They are just providing information through the BIS sheet for that
I guess
purpose.
I would love to see that written in there instead.
So can we approve the job description with the understanding that we're gonna look into this in good faith?
Yeah, I just don't want anyone getting,
Me neither.
you have a bad adverse reaction, and that's the first thing they're gonna pull is the consents, and they're gonna pull the process. We don't need to.
I think it's the process that we need to look at, not necessarily the job description, but the process.
Because I think this can be read as more of a procedural sort of thing.
Yeah, and I didn't read it
guess-
that way. I read it as, ooh,
Yeah.
what do you mean, you're gonna review the vaccines I need, you're gonna tell me what the side effects are, if you say, we're gonna hand you the sheet, and you can read it.
You're reading it with nurses' eyes.
Yes, I am. I'm reading it as a provider, and also, like, covered butt eye with an adverse event, so.
And that's why we have so many
Different people,
Yeah,
yeah.
yes, so.
I'll just inform we have to make it to 1 by 6.
Oh,
Okay.
So is somebody comfortable making a motion?
I can make a motion.
Please.
I move to accept to approve the job description of the certified medical assistant as amended, with clarification on paragraph.
We'll work on the process.
Yeah, work on the process. Jobs.
Second.
We have a motion and a second. Any further discussion or comment? Okay. All those in favor, please say aye.
Aye.
Opposed, say nay.
Name.
Motion carries. All right, next section, grant requests. We have no grant requests, no old business. We have public comment. Has anybody signed up for public comment? Next item, time and place of our next regular meeting will be September 17th at 4:30 right here, 4th floor, council meeting. We are, thank you, everybody.